views and opinions expressed by the host do not necessarily state or reflect those of the hospital and its management. Furthermore, the views and opinions of the guests do not reflect those of the host, the show, the management, and the hospital. Lastly, no copyright infringement intended. All materials used and music background credit to the owner for public service purposes only.
Alright, good evening mga ka-quarantine!
Welcome to
The Debunking Myths! Right, good evening mga quarantine. Good evening, Dr. Helen.
Mayong gabi, attorney.
Mayong gabi. Gabi na ba? Hapon pa, hapit na.
Okay, sige. Time flies when you're happy.
Kumusta ang Lunes? Adlong Lunes, Dr. Helen?
Sobrang busy, no? Pero hindi halata.
Hindi halata. O pariya sa itong mga quarantine nga sa mga panimalay karon. Kumusta ka mo diha sa inyong mga panimalay? Pwede rin mo send sa inyong mga pa-shout out or greetings para sa inyong mga loved ones.
Yes.
O kami dire ninyo makigistorya regarding debunking myths. Right, Dr. Helen?
Kung namoy gusto ipangutana, pwede ipangutana atong i-answer sa debunking myths.
So we would like to acknowledge sa tanang nagtanaw karon bisag asa ka mo dapita sa kalibutan, maayong adlaw Lunes ninyong tanan. Okay? So this afternoon, Dr. Helen, unsa gito atong panghisgot-hisgutan?
Yeah, we will be talking about mental health and the mental health misconception.
Yeah, and before that, no, atong tan-awon ang atong mga quarantine ay pahibaw sa atong mga quarantine nga natay daghan kay nga mga social media platform sa Vicente Soto Memorial Medical Center nga inyo yung ma-reach out ug matubag mo sa inyong mga pangutana, suwestyon, reklamo or inyong mga commendation sa atong mga empleyado. Unsa man ni sila, Dr. Helen, sa mga platform?
On Twitter and on Facebook, we are at official VSMMC, and on YouTube, we are Vicente Soto Memorial Medical Center, or you can also email us your photos, your videos, your letters, no, at VSMMC_OSM@yahoo.com. And our new email address, attorney?
It's osm@vsmc.doh.gov.ph. Alright? So again, that is osm@vsmc.doh.gov.ph. So, sa uban, no, ang atong importante diri sa Soto nga kamo maka-reach out sa mua diretso. So natay mga avenue. So di kita kinahanglan pa mag-uol, no, kung dili nato matubag kung natin mga pangutana sa itong mga hunahuna, palihog lang pag-reach out ani atong mga social media platforms. Right, Dr. Helen?
Yes, correct. Na ay chat box or inbox ang atong Facebook page. Pwede kamo mangutana or maghatag og suggestion or feedback. Or even your complaints. Kaya complaints, form of feedback man pud gyud.
Correct. Kinahanglan gyud nato na inyong mga suggestion or mga even complaints para mas mo improve pa ato mga serbisyo. Ug mga ka-quarantine kay Baumi, no, nga medyo ni-stricto na sad tagamay sa itong mga borders, especially diri sa syudad sa Sugbo, gikan sa itong news kahapon. So please lang, no, follow lang ta sa rules, and we have to do is just to present our IDs or certificate of employment.
And we should not forget, no, the ways that we can prevent COVID-19 transmission is to wear your face mask, your face shield, hand hygiene, and physical distancing.
Yes.
So, kung wala mo'y rason nga mugawa sa inyong balay,
ayaw na lang.
stay at home.
Mas muputi pa mo, nindot pang panit, no?
Daghan man pod mabuhat sa inyong
Sud sa panimalay. O karon no, dili ginato na siya ikalilong, kalilong no, nga COVID-19 really affects also our mental health.
Yes.
Nga, even there is a Soto Live, natay every Tuesday nga mental health check. But karong gabi una, Dr. Helen, it's always good to talk about the myths on mental health.
Naa di ay myths ang mental health.
Naa po yun di ay. Okay? So, kana siya mga ka-quarantine, paminaw no? Paminaw kay natay duha ka mga bagiitan kay nga mga doktor, ilahaning field para mas makasabot ta sa perspektibo sa uban regarding aning mental health, no? I know, uso kayo mental health, pero daghan pagyud ang pagyud kayo kasabot or ang gituhuan myths pa, Dr. Helen.
Yes, but mental health is very important now. It is one of our top priorities both in research and in service because naa na po gyud tay mental health law.
Correct,
So
correct,
even in
no?
the Senate and in the Congress, mental health has already been given a priority and we always have a mental health program. So this is our way. Of sharing the mental health program to you nga naa diha sa inyong mga panimalay, mga ka-quarantine.
So let's talk about the misconceptions, the beliefs, and also myths on mental health. So our dili lang usa, kundi duha ang atong gipadala diri karon sa atong expert chair, no?
Yes.
So let's start with the first presenter, no? He is a 4th-year resident and a from the CIM 2015. He loves, beach, taking hikes, and traveling around the world. Take note, traveling around the world. Kumusta sa ang mental health ani doktor nga wala pa sa travel at this time? Please welcome Dr. Gian Agustin Villas.
Department of Psychiatry or the Center for Behavioral Sciences.
Right, Doctor.
So, Dr. Gian, kamusta
Hi, Dr.
po?
Gian. Kumusta?
How are you? So, where have you gone in the world? Asa naman ka naka-travel?
Actually, last year, me and my fiancé went to Singapore and it opened my eyes to how beautiful the world is.
Wow.
It's a goal. It's still a goal that is yet to be reached.
Very good, very good. But this time, Doc, you said, you love traveling around the world, but in COVID-19, medyo traveling around our home ramanta. So, how was it?
Traveling at home.
Watching na lang high resolution ng mga videos about different places around the world.
Okay, or deciding where you want to go.
Yes.
So, where would you want to go next?
I don't know yet. Maybe Europe? I don't know.
Wow.
It's a goal. It's a goal. But
mataas ang COVID.
the Philippines is still our country is very beautiful as well.
Yes.
So
Yes.
need to complete those
travel
islands.
first within
The inter-islands.
7,107 islands of the Philippines.
Yes, Doc.
You said our country is beautiful, same like Dr. Helen. Alright. Okay, so Doctor, tonight you are going to present, myths or beliefs regarding mental health.
Yes,
Okay,
yes.
you may now start, Doc.
Yeah, so what's our first misconception? Okay, so depression results from a personality weakness or character flaw, and people who are depressed could just snap out of it if they tried hard enough.
Yeah, deep
Okay.
Doc.
Yes.
Sige, Doctor.
As attorney says, deep, no?
Deep kayo.
But first thing that pops to my mind and very glaring diha nga it's been highlighted, the word snap out of it.
Snap out of it.
Snap out of it.
It's not something like a light switch ba, nga you just turn on and off.
Okay.
Because as you can see, the depressed patients, no? Depression is not only emotional, but also it's a neurobiological phenomena.
Okay.
In deeper terms or in scientific terms, it has this effect on the brain.
Right.
Okay, it is our as we call our gasolina or ang duga sa utok na neurochemicals kumbaga if in English.
So chemicals in the brain.
Imbalances na ni siya. And it just does not occur out of the blue, no? It occurs kanang residually, insidiously, dugay-dugay ni siya from the events of one's life, no? There are many events.
Okay.
There are many predisposing factors, no, that enables us to be more vulnerable to depression.
Right.
So dili di ay ni murag
Kalit-kalit lang.
Di ni siya ingon nga
event.
weak ka, loser na.
Okay.
So events ni siya, events, how you are made as a person, how if example kaliwat ninyo, depressed or imong environment sa family nani, nagi na gyud.
Right.
Or
So
not
kung i-analogy natin, parang kahit gaano ka katigas na bato, basta regularly kang na-irritate, eventually you will also
you will break.
erode.
Yes.
Ganyan, Doc. So it's
Parang
not that
mga
easy.
artista, di ba? Like, okay kayo ang inyong tanaw. Even those kind of mga celebrities, okay kayo mong tanaw, natukag, very happy, very strong. Pero, niabot eh siya kalit. So, it's not pinakalit, good eh. This
Big
really
na siya,
it's an event.
Yeah. Example, like, since we're on the topic, example, artista. Many of them, they did not have childhood.
Yes, yes.
They were not able to enjoy their childhood. They're forced in the spotlight. Every action is well scrutinized. Everything they say, no matter how hard.
So, they're not really free.
Oh, they're not free. So, example lang, ana. So,
Correct.
you can just tell a depressed child actor nga who was not able to enjoy the joys of being a child nga ingon nga snap out of it. Diba? It's not that easy.
Yes, correct.
Ana lang as perspective.
Bitaw, even sa professionals nga nagtuo ba ang uban nga the professional is already earning much. But actually, if you look at it, it's not really about the earning, no? It's like hurot na imong oras because dili na ikitag-iya sa imong oras and then you have this engagement from one place to another. So lisod day siya and then it can cause these events mag-develop siya. Okay? And among gipahibaw balik sa itong mga quarantine kung unsa inyong makita sa screen ng mga slides, mao na ang mga misconceptions or beliefs. Okay? Dili na sila ang mga facts. Kaya ang ato diri sa debunking myths kay i-debunk man nato ang myths, di ba?
myths,
Atong
okay.
tagaan og unsay sakto. Okay?
Kan sila.
Ang depression tingali dili na just feeling sad, no? It's more than just
It's more than
feeling sad.
This is sustained sadness.
Sustained sadness.
Sustained siya nga maglisod ka, get out pa.
Okay.
So hindi kaya ng willpower lang.
Hindi yan willpower lang. Although pwede din kapag may strong will ka but you need help.
Yeah.
Okay.
Support, medication, therapy, ganyan.
So this is also a reason why we really need to focus on mental health because it has to be a community effort.
Yes, Doc.
Correct. Okay. Thank you for that, Doc, no? Maayo kay pag-explain ang ato number 1 pa to. We have 8 misconceptions karong adlaw.
Sige.
So atong bisitahon ang ikaduha.
Yan.
Psychiatric disorders are not true medical illnesses like heart disease and diabetes. People who have a mental illness are just crazy. Oh, this is totally unfair, no?
Yeah.
Totally not correct. Okay, for me, I'm not a doctor, but when I look at it, it's really not correct. These people are not crazy. Okay, doctor, please expound.
Just as you said it, attorney, no?
Yeah.
It's unfair, no?
Yes.
Because it's really minimizing psychiatric disorders.
Yes.
They're not true, quote-unquote, medical illnesses. You can say they're not purely medical.
Yes.
Because you need to consider the other end of the it's like other aspect of a person.
Yeah.
It's just not physical. So there is also psychological, emotional, that aspect of a person. So that is where the psychiatric field goes.
Yeah.
And it's not something that you can touch or something that you can measure with a laboratory test.
Yes, Doc.
No,
Yes,
it's-
Doc.
Correct.
Nicely put you, Doc. Yes.
Yeah, it's really a clinical diagnosis.
Clinical,
That is really
historical.
something man gyud no nga murag ang mental health diri sa Philippines ba nadugayan gyud siya because the society is putting a lot of stigma to
Yeah.
this kining mga inani nga mga illnesses ba. In fact, kung naay inani sa pamilya ang buhaton igaid, taguan.
Yes, Doc.
So it's
Yes. Yes.
even the own family of the patient is not accepting the reality. So there's a stigma. But now we are happy nga nalagid ba gyud ang mental health law, no? And it gives also budget. So they are not crazy once again to our quarantine
Actually,
out
I
there.
think it's very hurtful not to call somebody crazy or to call somebody buang. No, that's the local term.
Kaya may nga nabuang sa
Very
gugma.
demoralizing.
Nabuang sa
Kana siya lahi sa na.
Buang sa gugma.
Lahi sa na.
Yeah,
Okay. Very good.
Because
Very
it
good.
is actually clinical diagnosis, and it's only psychiatrists that can really diagnose.
Not just
right?
us, as doctors, we can diagnose. Yes,
Yeah.
it takes a good clinical and observing eye, and a listening ear, and a very.
So we would like also to acknowledge our live viewers karong gabi una, si Miss Laarni Lucias, good afternoon.
Yeah.
Nate River, good afternoon. Si Kiasi Uyaw Ocanya, hello, good afternoon. And Adet Del Rosario, good PM Doc Gian, Amping. And Jupi Girl Andaya.
Ako na
Yan po
ante.
si Gliceria, Enhambre, Rebecca Ruedas, Estela May Bacus Articuna, Jopi Girl Andaya.
Yeah, thank you so much for watching here sa ato being a live viewer that is a Soto Live, no? Di ba nalimutan og live sa video, Dr. Helen, kay they have to use data.
Oo.
Kung sila internet connections mo,
Something that I realized
data.
over the weekend.
Oh.
Kinahanglan di ay mag-data kung
Correct.
makaka-
It's an
FBI.
effort to watch. Okay? So daghan kayong salamat mga quarantine nga pila na ka episodes ang Soto Live na gihapon karon, no? Until pag yun ni kanus kutob, no?
So that goes to show nga atong mga masters ganahan gid sila makat-on more.
Yes,
Ganahan
yes.
sila
They
i-seek.
love learning.
They want to learn more ba sa other side.
Very good,
Sa
very
atong
good.
end ba, no?
Sakto jud kay na siya
A
dog nga
good
analysis.
health-seeking behavior siya.
Good. Thank you. And then let's go to the third one.
The third myth. Now, people with severe mental illness, such as schizophrenia, are usually dangerous and violent.
Tagay.
Okay.
Taguan or di ba?
So,
Palayo.
kanigid siya. I think one of the most common themes sa atong mga myths gyud kay ang naghead sa ilaha kay ang mga stigma,
Yes.
Stigma.
no? It's like calling an obese person a walking heart attack, no?
Yes,
Or
yes.
it's like
Or a
calling
lazy
that
person.
or a lazy person. So it's like that ba? Overweight people are prone to stroke. It's like
Yes.
that ba? Or kanang someone with a tattoo nga drug addict.
Oh,
Yes.
na.
Just some of the few stigmatizing nga
It's like
mga
stereotyping
it's
too.
Stereotype.
stereotyping
Dito
na
Mauni.
impressions ba. Although yes, many of our patients, especially when untreated,
Yes.
they are able to stop or they're able to keep their impulses in check.
Okay.
Like it depends, especially those who are able to have hallucinations nga auditory, mo man most common nga occurrences sa mga psychotic patients. Suguon sila nga hilabtin. That's when they go violent. But as is stated in the book, no, in our experience, their propensity to be violent is the same factors like you and me.
Siguro, Doc, to explain a little further, what is schizophrenia? Kaya it's such a
Schizophrenia,
technical
Doc,
term.
it's a morning gitawag na tong morning most common nga makita na to sa daan nga buang. Kasagaran nga kanang magyaw-yaw iyaha, psychosis man na siya. It's a long-standing chronic psychotic disorder na
Dili sila maka-differentiate kung pinuod ba niya
or
dili
baka
pinuod.
mao na siya Doc,
Or
man
it's in
schizophrenia.
their mind
Oh.
lang.
Dini siya split personality, dini siya na siya kanang mga hallucinations,
Hallucinations.
mga delusions nila, ilang una ilibakon sila, or ilang una patyon sila.
So,
Nanang
posibleng naririnig lang or nakikita.
inana Doc. So,
Yeah.
di gin na although yes, it's been well portrayed in the media good nga the crazy people will go violent,
Yeah.
they will kill, but their chances of being violent or killing someone is the same chances of you and me lang yun.
Correct,
An
correct.
ordinary citizen.
Yeah,
Oh.
Yeah,
correct.
but I think it would probably be frustrating to not be able to differentiate real from not real.
Yes,
And
Doc,
people
yes.
not understanding what you're trying to say.
Yeah.
I think that
Yes,
even
Doc.
even if I didn't have schizophrenia, if somebody couldn't understand what I was saying, can also push me to
Yes, Doc.
being, physical.
Physical.
That is what you're displaying, Doc, is a good showing of empathy.
Okay.
So, to those who have conditions, good.
Yeah,
So,
but I'm glad that there are actually movies that portray schizophrenia that can try to explain what the disease is.
Yes.
I think
Yes, Doc.
the only one that I watched actually is A Beautiful Mind.
Yeah,
Yes, Doc.
Beautiful
That
Mind
I
is
know.
really
Diba?
Oscars mo gito dong.
Oo.
Grabe ka
Crowe.
level.
Yeah, oo. Imagine, dami na niya nasulat, no?
Yes,
Kasi genius
yes.
eh.
Yes.
Genius siya.
Pero
Genius.
there's a very thin line between genius spontaneous and
Yeah.
knowing whether it's real or not real.
Yes.
And my take on this also is that we are, people, the ordinary people are looking these patients as, dangerous and violent, but without also realizing that with that type of mindset, it really brings a culture of discrimination and also culture of, not accepting, them as humans also. So, mura na akong makapangutan na, kinsa magyud ang tinuod na sakit. Ikaw nga inana og perception or ang kanang tao nga imuhang dapat sabton. So this is something that very much an issue in our society.
That's a very
So,
deep
mga-
statement.
Yes, mga ka-quarantine, importante kaayo nga masabtan ninyo na ang schizophrenia usa na ka disease. As a disease na ay possible na treatment.
Correct.
So kung naa kayo makaila nga murag dili sila natural ang ilang pagtingin.
Nilihukan, Dok.
Nilihukan. So simple
sinutian,
nga na i-refer ninyo sa atong clinic aron
Yes.
mahatagan og support, mahatagan og treatment nga kinahanglan nila.
Correct.
And also, the downside of schizophrenia is once you have it, it's like having diabetes and hypertension. You have it for
For life.
the rest of your life.
Yeah.
But it can
So,
be managed.
It can be
managing lang yun.
Okay.
Di
So,
na siya ma-cure sa...
Di siya ma-cure.
Pero, you can still be functioning with the
Yes.
right therapy, right medications, na siya.
And the right partner.
right avenue for
Right
treatment.
avenue.
Right
Yes.
family support
Oh,
as
support.
well.
Right support. Okay, so now let's go to the last meets for Dr. Gian. So we have
Yan.
therapy and self-help are a waste of time. Why bother when you can just take a pill? Sige.
So that's very intriguing. no?
Intriguing, ha?
Because therapy, it mentions two of our most effective nga forms of treatment. Therapy and also psychopharmacology.
Mm.
Okay.
So it is kanang having both, no, can really help a person.
Yes.
It is not just
Not one
the
over
science
other.
of taking a pill.
Mm.
Yes.
no? Being routinary nga, I'm gonna give you a prescription, then you take it. It's not that easy. Because there are many issues in a person's life. There are many events in their life that can traumatize them or scar them for the longest time.
Right.
And it takes more than just the highest dosage of medication to do that. And here, this is where our line of work comes in. This is where we use ourselves as therapists, psychologists, or psychiatrists, being that avenue for therapy,
Yes.
being that source of, being that someone to help them delineate all of these issues that is bugging them.
Alright.
So no medication can do that, but the medications do help.
They help. They
They
help
help.
remove the.
They help each other. No, they can go hand in hand.
Yeah.
Correct.
No, some and also it depends on a person. Some are just curable or treated with just psychotherapy. Some with just mild medication, but both of them go hand in hand.
Right.
You can never diminish one or the other.
Right.
No, the impact on a person's life.
Yeah.
Okay, this reminds me of one of the things that I learned in research, no? Common yung mga researches na knowledge, attitudes, and practices.
Yes, Doc.
But one thing I realized is that knowledge is not enough.
Yes,
Knowledge is not enough. It's important. It's a first step for us to know all of these disorders, all of these diseases. No, but it's more important also to practice or to your attitude and your practices should be based on your knowledge. Kasi we know that it's not good to overeat. It's not good to be sedentary. It's not good to smoke or to drink. But we keep on doing it, right? So it's just the same as this one, no? Na if you do know that you have a problem, you know the cognitive side is there.
So this is
but
what-
it has to be the attitude and the
Yes, Doc.
practice.
This is what we call, Doc, in our practice, insight.
Yeah,
Insight.
okay.
Yes, insight.
Not
Having
yung
that,
mga pa- insight?
yeah, insight.
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 Oh,
Okay.
insight. You know, having that good insight is you know you have the disease,
Yes.
and you know that you need treatment, and you're making the necessary
Taking the
actions, yes, to get treated. This is what you call insight.
So no
Help
denial.
yourself also.
Yes.
So I think
And
the
also-
bottom line is really to accept the diagnosis.
Yes. Also, this is also the function of psychotherapy.
Okay,
Because
good.
many patients, yes, I am aware I will take medications. Yes, I'm aware it will be lifelong. But with psychotherapy also, it helps them get in tune with the fact na be able to face the reality that they need medications
Right,
to
right.
be cured. So that's why it goes hand in hand.
Yes.
Yes.
So, Dr. Gian, thank you so much
Thank
for
you,
those
thank you.
words, no, and your wisdom for
Thank you.
this practical mental health ng mga myths. And do you have any
Thank you, Doc.
message for our ka-quarantine sa mga tao nga nagtanaw sa mga advice?
Advice, nakalitan ko, ako ka-prepare.
Naka-
Pero ano lang, never forget the different aspects on a person, no? It is us human beings, we're just not flesh and bone.
Yes.
No, we also have that spiritual aspect, that mental aspect, emotional aspect to make us complete.
Correct.
No, we can never be humans if we're just walking, talking, bag of bones and skin.
Correct.
So always consider the human person as a whole again.
Yes, as a whole. And with that, Doctor, from Maria Dolores Campos, precisely, Gian. Well said, Doc. Thank you for your inputs.
Thank
Congrats.
you.
Wow, thank you so much.
Auntie.
No?
Ako, Auntie.
Let's give round of applause to Dr. Gian. Okay. Now, before we go to our next 4 sets of myths, Dr. Helen, let's look at our figures of the day. Atong sugdan sa Sub-National Laboratory. Nitala na atong BSMC Sub-National Laboratory sa mga musunod karong adlaw Lunes, Pizza 16 sa Nobyembre 2020. 387 ka samples ang test karong adlaw. Ug kini tanan gikan sa Central Visayas. Sa kinatibukan, 106,993 na ka samples ang na-test sukad sa pagsugod sa atong Sub-National Laboratory. Sa 387, 11 niini ang positive ug 376 ang negative. So matotal, aduna na kitay 11,125 ka positive samples ug 95,804 ka negative samples. 41 ka samples ang kasamtangang nagdagan karon sa atong laboratorio. Pahinumdum lang sa tanan. Ang mga resulta base lang sa mga samples nga gitest. Ang Department of Health Regional Center for Health Development ang mupagawas og detalyadong impormasyon mahitungod sa mga positibo ug mga negatibong kaso. Daghang salamat.
Aniya na mga pinakaulahing balita kabahin sa COVID-19 dinhi sa atong tambalanan karong adlaw Lunes, petsa 16 sa Nobyembre tuig 2020. Ang soto mirehistro na sa mga musunod. Sa kinatibukan, 1,375 na ang kumpirmadong kaso diri sa atong tambalanan. 557 niini ang nakarecover na, 420 na ang nakutloan o kinabuhi na naggikan sa lain-lain nga lugar. Kung sa kasamtahan, aduna pa'y 20 ang padayong giatiman diri sa atong tambalanan ug 377 usab ang na-transfer sa atong mga isolation centers. For our bed utilization, BSMMC has a total bed capacity of 865 beds and a daily census of 681 patients. This gives us a utilization rate of 78.7%. The expanded COVID-19 bed capacity is 185 beds, and currently we have 20 COVID positive patients. This gives us a utilization rate of 10.8%. ICU bed capacity of BSMMC is 55 beds, and currently we have 80 patients admitted. This gives us a utilization rate of 32.7%. The dedicated COVID-19 ICU bed capacity has 24 beds, and currently we have 5 patients admitted. This gives us a utilization rate of 20.8%. Daghang salamat.
Okay, back to debunking myths. Dr. Helen, ato sa sigurong i-greet og happy birthday ang kining mga musunod, no? Happy birthday to Cassius May Villaflor from the OFS Health Facility Development Unit. Hi, Cassius May. Lord. And of course, to one of our Exico members, Dr. Regina Alfonso. Happy birthday, belated happy birthday. Happy birthday. Okay. So, ginaingon man Dr. Helen nga mental health is not a destination, but a process. And it's about how you drive, not where you go or where you are going. Okay? So, atong padayunon ang mga misconceptions on mental health. Please introduce our next
so fortunate to
presenter.
have 2 speakers today. So our second speaker is actually a 4th-year resident of the Department of Psychiatry or Center for Behavioral Sciences. He belongs to CIM Batch 2015. So mga ka-batchmates niya, so proud of him. He belongs to the same organization, the Total Outreach for Community Health or TORCH, along with Dr. Ding Lee Sankopan and Dr. Albano from Neurosurge. Parang shout out na kaagad to eh. I'm very proud that you are his batchmates. Mga ka-quarantine, help me welcome Dr. Edward Oliver C.
Yeah, Dr. C.
Hi, Doc. Hi, Attorney.
Hi, Doctor. Ini, maayong gabi na din meron. Oh, Dr. C. Maayong gabi. Okay, so 6 p.m. na mga higala, mga quarantine sa mga panimalay. So, nakakaroon si Dr. C. Kumusta, Dr. C?
Maayo ra gyud ko.
Kung saan mo na maayo, Doc?
Actually, excited ko man ako dito kay ang debunking meet.
Oh, debunking meets, no? Mas nindot ang debunking meets nga idip ko ano, with
sure.
conviction.
Yes.
Alright, okay. So, ready na kay Tadok nga mo debunk?
Sige.
Okay.
This is also how we fight fake news, no?
Yes.
By giving the experts na platform to discuss the truth.
Correct. So,
okay.
kay Bao tanong ato mga quarantine ka na dyan karon nag-angelus pa man, no? So, let's have the a little break. Or man na di ay ang break.
Or if we will give a few minutes of silence.
So, it's done na, Dr. Helen. Okay, so Dr. Helen, can we start the first misconception for the next sets, no? Okay.
The first myth, okay? I am not vulnerable to mental illness. Mental illness is the result of bad parenting or bad character.
Wow, judgmental naman. Okay, Dr. C, let's debunk that myth.
Ako makaingon ko no nga makasabot ko ani nga statement. But ato yung tanawon nga dili bitaw gyud na di ta kaingon ba nga ang mental health tungod na sa ato ang environment. Meaning to say this is an argument between nature versus nurture. Well, ako yung ingon nga dapat yung times nga vulnerable kita. Meaning to say hereditary na siya. Ang ato ang kuan atong mental health kay ingon ani man ni sa amo amang god neurosciences kung imo hagin tan-awon ang ato ang brain ang structure sana mao man sa gyud same structure sa ato ang kuan mga anak kay ma-inherit man sa nila. So panangitan kung prone ta to depression, then naa sa gyud na chance nga atong anak prone to depression. Just like kung may ang schizophrenia has a familial family within the family tree na ninyo, then most probably makuha gyud na nimo makuha sa gyud na
nasa lahi.
Yeah, I've seen a show on that katong real story na ang kuan ang sister, ang brother na ginagawa yes.
Pero mo sad na siya ang kaluoy gyud na kay tungod man sagud sa stigma, there's that tendency to think nga imong kalahi mga buang. But actually mo na siya ang mga tabangan unta nato.
Correct.
And that's where mental health plays a very big role.
Yes.
Okay, we should educate the other family members nga sige, since naman is yung family, we should know how to deal.
Yes.
How to deal. Kung magawas yun siya. Okay, mo man siya ang point yun nga. We cannot really kanang prevent it sometimes. Kung mugawas yun siya, like panangitan, hypertension, diabetes.
Yes.
You can do lifetime modification. Pero kung strong yun, or di makita makaingon, kay panangitan sa mga mental health nga mga issues, kung accidents happen, people die, your parents die, there are issues that will happen, then lagi yung chance nga maigo yun ka.
Igo yun ka.
Kung imuhang coping, wala kaayo na strengthen pag-ayo, then mo na siya. Ang ako maingon yun, I would advocate how we deal with it as the family members nga kuyog sad sa ato ang kuan.
Para ma-ready gud ba no?
Tinod.
So I think having a particular disease is multifactorial. So
Multifactorial
I think
siya.
equal ang contribution ng familial or genetics plus yung environment.
Ako maingon jud ko depende na sa unsa nga libro imong basahon.
Oh, depende sa libro.
Depende sa libro.
Okay.
Pero mo na, the bottom line is dili na siya ingon anak importante kung asa gyud mas bugat, but we place equal emphasis on
Correct.
both of them.
Okay.
Okay, one or the other. Maingon jud
Yeah, it cannot be that we only see it in one perspective, no?
And actually, mo ni siya
Makita
ang atong myth.
Correct.
It is the overemphasis in bad parenting and bad
Or
character.
Correct.
Oh. Pero dili sad naingon nga di ka sad-an kung
Kasi
nasa
walang
we have
may-
free choice man sad.
Walay training sa parenting man, di ba?
Wala.
Walang school for that.
Wala, mo na siya ang kalisod yun actually sad.
Correct.
And if you will think that way kasi, ang dami nating teenage parents, teenage mothers, teenage fathers, that they themselves have not yet truly developed.
And they're not ready.
They're not ready.
Yes.
So they probably will end up as poor parents.
That's why there are also, in law, right? There's declaration of nullity of marriage due to psychological incapacity. And people are thinking that psychological incapacity deals already in something crazy ka, but it's not. You have also to check the environment, the parents, whatever. Kumplito gid ang perspective sa pagkuan ba assess nimo sa patient, no? So dili pwede nga mao na ni siya katungod gikan man siya sa broken family or gikan man siya sa kanang kuan niya mao na sa niyang character, no? It's not as easy as that. Dili na siya diretso. Okay? So mao na siya.
And I guess if you do know that you are at risk, no? It's important to realize that healing takes time and asking for help is a courageous step.
Correct.
Yes, Doc, sakto you can
First step.
asking for help.
Yeah, asking for help. Do not be afraid, mga quarantine. Karon is open na good kayo, no? We have the mental health law. Yes, our country is medyo delayed ana dapita sa progress on mental health legislation, but there we already have it, no? So dili na kinahanglan pa mag-uol kay na available na ang tabang, no?
And in all forms of communication as well.
Correct. So
Tinood.
Thank you.
So Doc, if somebody
Yes,
needs help, what are the resources that are available? If somebody, for example, in Cebu, needs somebody to talk to, what number can they call?
Kana no, ako I would volunteer ang amo kuan teleconsultation service.
teleconsultation.
Oo. Pero I would warn nga dili sa gyud ingon diha dayon nga dis so gyud kay ang kani manggod ang Filipino culture manggod dapat ko tay strong emphasis in family and bonding.
Yes.
Sometimes that's enough. Pero kung di sana siya available then well mo na namin kung magstorya ta.
Yes, agree.
Okay.
Lisod man sa gud.
Correct.
Kung mapugusat gud kung wala gid ay imong kuan family there or wa mo net or naglisod ka kay wa kay kwarta just like some of my patients. Katoy yung giingon ganina nga load gamiton ninyo yung data.
Yes.
Yes, very cool kay kami karon we do our online consultations via internet. Yun. So
Yeah, internet naman.
we need to see our patients.
Yes,
Sabi na,
it's important to see the whole family actually, no?
Actually, when we have time, yes. Pero ako mo focus man ko on my patients when I talk to them. I want to get their views. Kaya,
Correct.
mo lagi ako man ay tailor fit food.
Tailor
Sa
fit.
kung say needs nila. So I can only do that if I see them and
Correct.
kuan get face to face. Di magita maka face to face pero
Yes.
good enough na lang nga.
Yes.
Makita mi ba.
And we have a very good question here from Laarni Arcilia Lucias. Dr. Helen, can you read it?
Yeah. Hello, doctor. What is your take regarding those people in the workplace who are so emotionally overwhelmed that they tend to negate and influence other people, trying to understand them really?
Yeah, so kung may mga bad character yung may naanak ang mga terminology.
Oo, parang sa same as my residents, no, a number of them really feel na when they are pushed to perform, naisip na kaagad nila, binubuli sila, or they have a feeling na,
That is a sign of burnout.
burnout.
Yes.
A sign.
Ingon ani man na siya. Kung ang tao manggod okay siya, I don't think people are malicious enough to really look for discontent or so
Correct.
discontent within the workplace.
Yes. So,
Correct.
if they were any better, then I would believe nga maningkamot sad sila
Yes.
to deliver what needs to be done. So kita man dire sa atong hospital, service oriented
Mm.
magyunta.
Correct.
So come the time kung naay mga tawo nga we need to understand ba nga they're going through something.
They're going through something.
Tinod. But dili sa na siya ingon nga unlimited sa datong kuan kay masacrifice man sa nato atong efficiency sa tuang kuan
Correct.
services. So kailangan din nato i-balance discipline and understanding.
Correct.
Which
Balance
is
sila.
mo na siya ang art of mental health.
Correct. The art of mental health. And also in the human resource perspective, always remember that there are types of employees, the engage and disengage and actively disengage. So it's good to understand where they are so that you know also the interventions that you can do in the workplace. Okay? So kini may naani nga mga klase, these are the disengage. So that's why we have to check the reasons why they are disengaged. Okay, so muna nga they can influence also. So that's it. No, we can always add mixtures of perspectives on mental health and also in human resource management. Okay.
I just want to interject this saying.
Interject.
It's from Google, no?
Sige do.
Just because no one else can feel or do your inner work for you doesn't mean you can, should, or need to do it alone.
Tinood.
Tinood kayo na, ha?
Everyone needs help once in a while.
Everyone needs help.
No
No one is an island.
island.
Di ba? Okay, gabi na kayo. Ang wave. Okay.
Okay, inyong hangkwan
Yes.
intuition.
Kamu ba kunin magpayon nga og Soto live? Okay, diretso na ba mo mga quarantine kay para lang gyud mo ma-reach out sa Soto sa inyong mga panimalay or bisag asa ka mo karon dapita. So, I'm excited ko ano yung ikaduha nga misconception ni Doctor. Okay, please publish this one. I'll read this one, ha?
Yes.
Addiction is a lifestyle choice and shows a lack of will or power. People with substance abuse problem are morally weak or bad. Okay.
Addiction.
So, this is totally a misconception. Okay? Doctor, please explain.
Sige.
Please debunk.
I think one of the best ways siguro nato na siya ma-explain is to see addiction as a defense mechanism. Mahog na siya, it's our way to cope ba?
Our way to cope.
With the stresses. Kaya, muna ni man kung papilion nyo ka, would you really want to smoke or would you really want to enjoy or talk to your family?
Yeah. Okay.
But, muna nini, kung bati mong family, wa mong papa, putro sang adik, putro sang magsigarilyo niya, mangulata sa imong mama. So, how do you cope? Siyempre, you cannot really trust other people kay mo man imuhang pagdako di man kay ka makasalig sa imong parents to be there because they have their own problems. So how do you cope? You cope through other means. So the most common is kana substance use. So manigarilyo, mag-inom, uban, well magshabok. Pero dili ra gyud ingon nasa gyud uban nga shopping addiction. There's such a thing.
Yes.
Nasa na siya sa uban akong mga pasyente or di ko mo mention ng mga names or an addiction. Food addiction, pwede. So, kanang mga ingon ana, it's the person's way of coping and dili sa na nato pwede or maayo kasab-an or i-lockdown or atong sabayon because that's the best they could do at that particular moment. Mo na kana kami mo advocate kami tabangan. Kung murag na adik imong kauban tabangan.
Yeah.
Dili siya sa wayon or ingnon nga usa man kawing ilad man kay kabatasan, wa man kay mga murag.
Yeah, I really understand that because I remember before we were having these pro bono cases with because in legal manggod we have to go also with mga legal aid programs and we asked them why are you using this substance and according to them mas better magud attorney nga mas taas sa mong time sa pagtrabaho kay bugat among trabaho and then we are also serving our family breadwinner biya mingat kinahanglan trabaho jud nga di ka kapuyon. Okay? And they rather use that kay di sila ma-hungry so di sa kinahanglan masigpalit og pagkaon para mas dako pa sila madala sa ilang mga panimalay. Maunay girason sa amoa which in fact if you are going to talk to them with empathy masabtan nimo. But this is not to judge them or discriminate them but rather we offer help, no? Kanang unsay pwede nilang mabuhat para better alternative. So inana ba? So ato po nang saton nga nagin ay mga rason-rason tanan. Okay?
But the problem kasi is when you lose control.
When you lose control.
Mo na siya ang bad aspect sa addiction.
Correct.
Kay katoy mo giingon attorney no. Sa ako that's a very red flag nga
Correct.
explanation tungod kay they're rationalizing
Correct.
their substance use.
Yes.
So in that regard, then open sila to that maladaptive practice. When
Correct.
unta nga temporary ra unta na siyang addiction for you to improve.
To improve. Correct, correct.
But mo sa lagi na ang kadaot kung methamphetamine ko is very addicting.
Addictive.
Addicting.
Oo.
But sometimes, no, you most of the stories I get from our patient is they get things in the house and sell it just so that they can buy.
Dok na ako'y pasyente sa
Oh.
una. I will not mention names yun natin. Ano man, hindi ko so pahamak. Naabot sa point nga yung addiction, mubaligya siya sa insulin siyang luna. You imagine kung sa ang effect yun.
Ipuli na gyud.
Oh.
Ngay may nana dok nga ibaligya or mukawat.
Tinood. Mo na siyang psychopathology.
Correct.
Pero it starts out as a way to cope. Mo gina siyang addiction.
Yan,
Pero
ni kuan lang, no? Wala na
Escalate
control.
na. Escalate beyond their
It
control.
progresses, no, to the point that you lose control and it's your addiction that has control over you already.
Tinuod. Kasagaran sa kong mga pasyente sa una nga sa alcohol, mga withdrawal, ingon ana og history.
And that is why I think kasi si Dr. Ray Bautista, one of my good friends, handles the Talisay City na rehabilitation program. It's
okay.
outpatient, no, but they really focus on self-determination and self-care. And one of
Self-care.
here the definitions of self-care really is self-care is how you take your power back. And it is you're the one who really wants or decides that you will take control of your life and not
Nindot
allow
na.
your addiction not to
Nindot
take
na.
control
Because
of
the
your
power is really within you. Imuha mo gyud na.
Yes.
That's your decisional privacy in the first place. But you have to take good care of it.
But
Okay?
hopefully sa Diyon, dili na dapat nila ang utok. Kaya
Yes.
as with substances manggod,
May side effect.
nagyan na siya changes sa brain. Ang atong brain manggod, I think during the 1996, mga ingon na early 2000s, na ang mga research niya is geared towards neuroplasticity. Meaning to say,
Okay.
ang atong brain also adapts to whatever we do. So, mo man na siyang basis na mo sa mong pagtambal. Kung ang mong pasyente mo deteriorate siya, then there's also a chance na ma-okay sila.
Correct.
Oh, labi na sa kanang mga depression nga.
Correct. Okay, so thank you for that, no? So let's kuha lang yun, no? It's more of respect and tolerance at the
Yes.
same time, helping, reaching out. Okay, next, Dr. Helen.
Sige. Next, people with mental illness should not have the same rights as the rest of society.
Kasi kasulti, we have the same rights, di ba? The Universal Declaration of Human Rights also dapat applicable sa tanan.
Sige
Murag
daw.
kuyaw makihang mag-ingon.
Exactly, because we also have equal protection clause, in our Constitution. That's really something that we have to adhere to.
Pero,
Okay?
I think ang argument ani attorney, it comes with the fact nga ang atong pasyente may have rights, pero when should those rights be committed? I mean, kasi man siguro nabailain mas maayo nga term.
Waiver of rights?
Ma-waive, or di ko sa mga waiver, murag mas bugat ba? Like, for example, if a person has the right to choose ilang type of treatment or what they want to do, when can we say nga dili na ni siya pwede mo decide sa iyang treatment? Kaya panalitan.
When there is already, an aspect sa consent, di ba? Because basically, there are some groups manggod of mental, the patients ba? They cannot decide for themselves anymore. So they cannot give consent and they don't understand anymore.
But it has to be somebody who has the best interest of the patient.
Yeah, the best interest, which is the doctor. And in fact, the doctor, when it comes to giving consent, they're part there. Apil man na sa linya, who can give consent? It's a doctor. If the patient cannot do it, because the patient is, then the doctor can give consent.
I think mauna siya, ang ethical issues, doc. So, when does beneficence sa doctor outweigh the autonomy sa patient? When can we say that? I think maugyod na siya ang isa sa murag lalong nga issue din, ha?
Yes,
And if you're talking about rights, not human rights, it's also non-maleficent.
Non-maleficent.
So, first of all, do no harm.
Do no harm.
So when somebody is isolated because he or she is posing a harm to himself or other people, that's actually allowing the patient not to do harm to anybody. That's protecting
You're protecting
his or
the
her
patient.
You are protecting.
Oh.
Okay, so
I think mauna
Yeah, it's not an issue on the rights or like
I think
that they do
we
not have
agree
the rights.
Everyone
but
agrees.
I think also no in institutions when people are institutionalized for mental health, no the setting, the environment as much as possible should also respect that these are humans too.
Correct,
No?
correct.
That they need special care on a day-to-day basis.
Yeah, actually, look, we have very strict protocols on when to restrain, when not to restrain our patients. Kaya, as much as possible, man good. We want our treatment to be not traumatic to our patients. Kaya kung traumatic na nasamot, di na siya mo salig, dili na mo tumal-stambal, then makaingon ko in that regard, we failed as a doctor. We failed in helping our patients cope and become better. Tungod lang kay kana, isamukan mi istorya niya amo ning hikta no. There should be a check and balance. There should be a standard.
Correct.
Kung na amo ang i-try og uphold yun.
Correct. Okay, so clear na ha.
Okay,
And our last myth for tonight. People with mental illness may often feel embarrassed or that they are inferior to others, experience low self-esteem and low confidence. Okay? Doctor, please.
Well, I can say nga naagi yung mga tao. But that depends on sa ilang sakit. They might feel embarrassed, labi na sa mga depression, labi na with that stigma that's going around associated with mental illness. Pero napasa tayo uban mga pasyente nga makaingon ko has true emotional insight. Meaning to say, they accept nga na sila mental health issues with panangitan kani atong mga pasyente nga naay social phobia, so meaning to say they're not that comfortable speaking in front of a crowd. So
correct.
for you to overcome that, you have to accept na ka. So kung in that regard dili kita kaingon nga although mura siya ma-embarrass at first, pero it's a way for them to get better.
That's true. So I think bottom line really, when you talk about self-esteem, is that you go back to biblical, no? Na you are made in the image and likeness of God. And intrinsically, no, you are beautiful. You have dignity, you have worth. If you go back to that ideology na kahit sino ka pa, kahit ano pa na-experience mo, importante ka. No, you go back to that, then you will realize that whatever you are going through, you are important.
Yes.
You have essence, you have worth.
Tinodok.
Yes.
And some philosophic nga mga ideas, no? Ang atong mga ancient Greeks, they propose man gud nga your value comes from being a human being. Dili lang ingon tungod sa imong na-achieve kay not everyone can achieve the same thing, but
Correct.
diha na siya ang basis sa atong human rights.
Right.
Because you exist, then you have value.
Correct. So, mga quarantine, I know you really learned a lot tonight, no? Mga insights and also very good mga kuan ba? Mga tuhuan ginato mga pag-debunk sa myths nato because we have experts here. And in as much that we want to discuss no further kani ato ang topic karong gabi una, but naman gitawag og oras, Dr. Helen, no? So before nato ibalik si Doctor for his final words on that, we have here also from Judge. Can you read it, Doctor?
Okay. So, if things are not so good, you may want to imagine something better. This is from John Forbes Nash.
Yeah, a beautiful
I think a
mind.
beautiful mind. I think na
A beautiful mind, right?
Agree.
And we have also here our contact numbers, no, for the OPD. Here, our outpatient services operations are temporarily suspended until further notice. So we are doing the teleconsultation. Okay,
Yes.
Doc, asa itong tawagan nila doon sa Center for Behavioral Sciences?
So, kanang number na din ha, ako lang i-mention out loud, 253-4423. And you can also text or call yun. Mas mayo i-call lang amo ang teletriage. 0929-287-3688.
Sige, tawag-tawag para masturya na to ato ang mga doctors, no?
schedule
Mga
mo.
maayo nga doctors, mas-schedule mo sa atong Center for Behavioral Sciences. Okay, Dr. Helen?
Yeah, so whatever you are experiencing now, kung nag-uol mo, kahit basin nitaas na po ang number of cases of COVID in our society today, remember that this too shall pass. And
Correct.
everything will be alright. If it's not yet alright, it means it's not yet in the end.
Correct, it's not yet the end. Okay, hapit naman yung Pasko. Atong tanawang pila na lang kahadlaw before Christmas. Wow, 39 days to
Yay!
Christmas bonus. Pero sa akong nahibawan ang mga government employees, Christmas bonus marong adlaw. This is the 30th month pay for government, I think, no? So, employees. So, tanaw-tanaw yung mga ATM diha, mga tutunians. Congratulations. So, daghan kitang pasalamat, of course, no? Sa atong 30th month pay, pasalamat sa atuan, Dr. Helen.
Sa atong Incident Commander, Medical Center Chief and Producer, Dr. Gerardo M. Aquino Jr.
Thank you, Dr. Aquino, and also to Dr. Jaime Bernardas, our Regional Director for CHD7.
And for all the takers of the Physician's Licensure Exam, good luck, God bless, you can do it!
Yes, you can do it. And also to the team of the Sub-National Laboratory of Soto and Dr. Ligaray. Maayong hapon.
Dr. Reynet Ligaray. And we would like to invite all of those who have already passed the licensure exam. Join us here in BSMMC. We have different residency training programs that you can choose from.
And one of that is for the Psychiatric
Department of Psychiatry. If you want to talk about mental health.
Yes. Especially that's already something kung ano gina siya mo na nagtinutukan karon nga field, okay? Closing?
Well, sa atong mga viewers, I think ang ako ra yung one and only message. You don't have to go through what you're going through alone.
Yes.
Kung naaragin mo nito, tawag lang, pa-schedule.
Correct.
Okay.
Dr. Helen, kay pakuan ha, kicker of the night?
Ayan. So from Emery Lord, he says that my dark days made me stronger. Or maybe I already was strong and they made me prove it. Ayan.
Wow. And from Stacy Swift, it is okay to make mistakes, to have bad days, to be less than perfect, to do what's best for you, and to be yourself. And it's okay not to be okay. Alright? So, kung ano gina? Then, Doctor? Nindot. Nindot.
Nindot yung mga aguan. Ako rin, you not to be alone.
Para pakikir na mo dire. Pasalamat na sa ating mga COVID warriors, healthcare workers, and our survivors. Okay? And also to our partners, donors, sponsors, and to all our ka-quarantine. Thank you so much, Dr. C, and Dr. Gian, and Dr. Helen.
Okay.
Kung sa atong ikasulti, Dr. Helen,
Kay Denisa Soto,
kalidad nga serbisyo, among garbo. Kini si Atty. Panugaling.
Dr. Helen Madamba.
Mao kini ang Soto Live. Mayong gabi!